can now begin the case.
Hi, how are you doing today?
Well, I'm in the hospital.
I see that. What's your full name and when were you born?
Joni Toby, September 22nd, 2001.
Joni, it's really nice to meet you. My hands are dry now, so I can shake your hand. My name is Rachel LaBelle. I'm a student physical therapist at Emory University. I came to work with you today and see how you're moving.
Okay.
Okay. So what I want to do today is oh, you got a mighty cough there.
Sorry.
That's okay. Any pain with that?
No, it's just hard to catch my breath.
Okay. Are you feeling short of breath right now?
Yeah.
Okay. And then do you have any pain anywhere? I know you said you weren't in too much.
No.
Okay. I'm glad to hear that. So what I want to do today is just take a look at how you're doing, listen to your heart and your lungs, and then my goal is to get you up and sitting in a chair. Do you have any questions?
No.
Okay, as we keep going, I'm going to keep explaining and talking through whatever I'm doing. If you have any questions at any point, just let me know. Do I have your consent to continue?
Yeah.
Okay. First thing I want to do is listen to your heart, okay? So, what I would like to do is I'm going to clean my stethoscope. Oops. And I do have to go under your gown for this part. Is that okay?
Yeah.
Okay, so I'm just going to go under the top at 2 points. So I just want you to breathe. You can breathe normally for this. Your heart sounded really good. I heard 2 distinct, those love dub noises that we like to listen for. Now I just want to feel your pulse, okay? I want to feel it for a minute, count the beats, and get your heart rate. So I'm going to be quiet for a minute while I time this. Do you mind if I just grab your wrist? Relax your arm down for me. I'm just feeling for a pulse to yours. This feels nice and strong. So I got 67 beats per minute. That's within your normal range with your age since you're 18. And it was also very strong and regular, so that's really good to feel. I'd like to do the same thing on the other side just to check for symmetry. Is that okay?
Yeah.
Would you mind reaching your arm across towards me? I'm just going to feel for that pulse again, okay? Okay. Feel strong and regular on that side too. And while I was looking at your heart rate, I was also looking at how you're breathing. Your chest is rising equally on both sides, so that's good to know that both sides of your chest are working the same while you're breathing.
Mm-hmm.
And your respiratory rate was 10 breaths per that 30 seconds, so that'd be equivalent to 20 breaths per minute, which is a little high for you, but considering you're a little bit short of breath, that's to be expected as well. So the next thing I would like to do is take your blood pressure, okay? Is there any reason I can't take it on this arm?
No.
Okay, I saw you have an IV on that other arm as well.
Yeah.
So tell me a little bit about yourself. Where do you live?
I live on the UGA campus,
Okay, what year are you?
freshman.
How do you like it so far?
Well, it was good until I kind of got sick.
Yeah.
Yeah.
When did you start feeling sick?
Well, I've been sick like my whole life, but it got really bad like a couple weeks ago.
Okay. Have you been able to keep up with your breathing treatments at school? I know I saw you had cystic fibrosis.
I do them like sometimes, not as much as when I'm at home.
Okay, I'm just gonna feel for an artery. Alright, so I'm gonna put my stethoscope right where I felt that, and then you're gonna feel this cuff get tight, and I'm just gonna be listening for a couple sounds, okay? So it's gonna be quiet for a little bit. Alright, your blood pressure is great. I got 118/68. Looks really good. I'm just gonna stick this on the table over there. So have you noticed anything coming up while you're coughing?
Yeah.
What color has it been? Have you seen that? No, it's been green.
Yeah.
Okay. Is that normal for you?
No, it's usually like clear and a little bit yellow.
Okay, so that could be a sign that there's something else that your body's fighting. So I want to encourage you to keep coughing and try to get that gunk out, okay?
Okay.
Alright, so the next thing I want to look at is how well you're moving. So I want to start with your arms, and I just want you to follow my movements, okay?
Okay.
Alrighty, so you do have the IV in that arm, so I'm going to make sure you have enough slack over there, and it looks like you do. So I want you to bring your arms up as high as you can. Yep, straight up there. And then pointing to the ceiling. Yeah, so straight towards the ceiling. Good. I want you to hold right there. Don't let me move you, okay? I'm going to try to push you down. Up. Don't let me move you in or out. Good. You can relax your arms down. Now I want you to be very careful of this IV. It looks like it's just above your elbow. I want you to bend. You can bend this one up all the way. This one stop just before. Good, and then straighten all the way out. Good, any pain with those? Alrighty, I want you to hold them right where you just had them actually. Don't let me move your elbows down, okay? Stay right there. Now don't let me push you up. Don't let me push you in. And don't let me push you out. Good, you're really strong. I want you to move your wrist back and forth like that. Good, okay? Hold your wrist straight up like this. Don't let me move you down. Good, now don't let me down. Alright, and now last one, squeeze my fingers as hard as you can. Squeeze, squeeze, squeeze. Nicely done, you have a very strong grip. Alright, I lied. One more with your arm. I want you to grab my hand. Yep. And now slide your hand so it's grabbing my forearm. Alright, now don't let me move your arm, okay? I want you to hold right there. I'm going to try to turn it. Good. Good. Alrighty, same thing with this side. Yeah, and now try to twist my arm like a doorknob. Yeah, and twist the other way. Good. Okay, that looked good. How are you feeling so far?
A little tired, but
A little tired? Okay. So if at any point you get tired and you feel like you can't catch your breath, what I want you to do is a breathing technique. So I want you to breathe in through your nose and blow it out like you're trying to blow a kiss. Just like that. So we're going to go over that more, but I noticed you were getting a little short of breath as we're going through, so I just wanted to teach you that breathing technique right now, okay? The next thing I want to do is look at your sensation, so how you're feeling. So I want you to put your arms straight out. Yep, relax them down. Put your thumbs so they're towards the ceiling. Good. So I have a piece of paper that I had used from when I cleaned my stethoscope. So I'm going to use that. You're going to feel two different types of touch, a sharp and a dull. I'm going to test them out right here on your arm. So that's dull and that's sharp. You feel the difference? I'm going to ask you to close your eyes and tell me if you feel either sharp or dull and where specifically you feel it on your body, okay? Alrighty, sure.
Dull.
Where?
Right arm, like elbow, kind of.
Mm-hmm.
Sharp, left wrist. Dull, left shoulder. Sharp, right wrist. Sharp, right shoulder. Dull, collarbone, right collarbone. Sharp, left elbow.
Okay, you can open your eyes. That looked really good. So you got all those correct, so that just tells me that your sensation is intact. Now, do you mind if I just look at your arms to see for any swelling?
Go ahead.
Okay. I'm looking here. I'm also looking at your fingers for any redness, any signs that you're not getting blood flow down there. So if they were pale or cold or blue, checking your nails for a capillary refill. So that's just if I press down, that stops the blood flow, and then how quickly it returns, and yours returned really quickly as well. I'm gonna check over here as well, okay? That looks really good. Same thing over here. Okay. Do you have any questions so far?
No.
Okay, your upper body looked really good. Now I'd like to do the same thing and look at your legs. So I want to look at how you're moving, your strength, and also your sensation. Any questions?
Go ahead.
Okay, so I'm gonna do the right leg first. Do you mind if I take your socks off?
Go ahead. My feet are kind of cold.
Okay. I will only leave them off for as long as I need, okay?
Okay.
So how about we do the sensation first? So I'm just gonna expose this leg as well. That way, once I'm done with this, I can put your socks right back on.
Okay.
Hold this leg for me. Good. Okay. Do you live in an apartment or are you living in the dorms?
I live in an apartment off campus with my roommate.
Sorry. Do you have any stairs?
Yeah, one flight to my bathroom.
Oh, okay. So you live on the ground floor, but the bathroom's on the upper?
Yeah, I don't really know who designed that.
Yeah, that's a little weird.
Yeah,
How many stairs would you say there are?
probably 8.
Okay. And then
Yeah.
do you have railings?
Mm-hmm.
One side or both sides?
Both sides.
Got it. So I'm gonna do the same thing down here. I'll let you feel that sensation again. This is gonna be dull. And I lost my tape. There it is. And that's shut.
Okay.
Feel a difference?
Mm-hmm.
Close your eyes.
Dull right knee. Dull left foot. Sharp left knee. Sharp right foot. Dull right heel. Sharp left heel. I felt something on my foot too.
I'm sorry about that.
Sharp right knee. Dull left knee.
Okay. I'm gonna put your socks back on. That was very good. Again, your sensation's intact. And while I was asking you those questions, I was also looking at your feet. There's good signs of blood flow. Your feet aren't blue or cold, and there's no sign of any redness. So because you've been laying in this bed, I'm gonna guess you haven't been moving around too much, have you?
Not really.
No. So I was looking to see if you've been getting any, we call them a pressure wound, and that would be a sign just by redness on your feet, but you don't have any of that. So that's a really good sign.
Okay.
Alright, so let's get started looking at how you're moving. I want you to bring your knee to your chest. Good, and straighten it back out. Awesome job. Bring your leg out to me and back in. I want you to bend your knee as much as you can. Straighten it back out. Good, and move your ankle up and down. Awesome job. Alright, I want you to push down in my hand. Good. Really strong. And now pull up. Good. Bend your knee. Relax right here. Don't let me move your knee, okay? I'm gonna try to pull you out. And then pull you. Good, okay. Now pick your leg up a little bit. Hold it right there. Don't let me move your hip at all, okay? Don't let me move you down. Or up. Or in. Or out. Nicely done. Any pain with any of those?
Mm-mm.
Okay, straighten out your leg. Do you use anything to help you get around? Like a walker or a cane? No? Okay. And then is your family close by?
They live in Atlanta.
Okay, if you needed anything, could they come up like within a couple hours to come see you? Okay. Alright, I noticed you had a Foley catheter over here. Do you mind if I look at that?
Go ahead.
Okay, I just want to make sure that it's intact.
Okay.
Okay, that looks very good. So I want to do the same things you did on the other side. So bring your knee to your chest. Good. Straighten it back out. Bend your knee. And straight. Bring your leg out towards me. And in. Move your ankle up and down. Good. Okay. Now push down into my hand. Push, push, push. Good. Pull up into my hand. Pull, pull, pull. Nice. Bend your knee. Don't let me pull your leg out. Good. Don't let me push your leg in. Awesome job. Lift your leg up. Hold it right here. Don't let me move your hip. I'm going to try to push you up and down. Good. Don't let me move you in. And don't let me pull your leg out. Nicely done. You can relax. Okay, one more thing I want you to do with your legs. I'd like you to take your left heel and rub it up and down your right calf, or shin. Sorry about that. Good. And relax. Same thing over here. Good job. So your strength looks really good on both sides of your legs as well, and your range of motion, so that's just how much you can move. I didn't notice any deficit side to side, so your strong is equal on both. And then that last test that I did was just looking at how well you can coordinate your movements, and you did very well with that. So I'd also like to look at one more thing with your arms. I want you to touch your nose, touch my finger, and then touch your nose again.
You moved it on me.
I know, I'm sorry. Relax. Good. Same thing with the other hand. Good job. Okay.
Okay, Jenny. So, next what I would like to do is listen to your lungs. So, what I'm going to do is using my stethoscope, just have you breathe in through your mouth and out through your mouth. Nice big deep breaths. Please let me know at any point if you feel lightheaded or dizzy. And I would also like you to face that way, just because that way you don't breathe in my face and I'm not breathing in yours as I'm listening. Okay? So I had already cleaned my stethoscope. Alright. And I am going to have to go under your top here. Is that okay? Yes. Deep breath in. Again. Yeah, that's okay. Okay, I'm still listening to your lungs, but it's just going to be around your stomach area, okay? Okay. Good job. Okay, Jody, so those all sounded nice and clear. Now I just like to listen to the ones on your side, okay? So, deep breath in. Okay, Jody, I'm going to come do the same thing on the other side. Deep breath in. Thank you very much, Jody. While I have you laying down, do you mind if I also feel for how your walls or chest walls are moving as you're breathing? Okay, so I'm going to put my hands in a W on the top of your chest and also by your stomach. Deep breath in. And again. Good. I'm going to do two more and I'm going to have my hands on your side, okay? Deep breath. Good. Turn to the other side. And this side. Those felt really good. So what I was feeling for was your chest walls expanding They expanded equally on both sides, so that's a very good sign. It means that both sides are working equally. So, next what I'd like you to do, I want to assess the back of your lungs as well. So I want to do those two tests while you're laying on your side. So what I'm going to have you do is bend this knee. Good. Okay, so the IV hole is close enough. I'll just move it a tiny bit closer. What I would like you to do is move your hips closer to this edge. Good. Okay, reach across towards the edge of the bed. And roll towards me. Okay. I'm gonna keep my hand on you and just move around back so I can look at your back, okay? Do you feel comfortable here? I feel comfortable. Okay, can I just have you shift your shoulders back a little bit? Beautiful. Okay, so keeping one hand at all times. Okay, same thing, I'd just like to listen to your lungs. So deep breath in through your mouth and out through your mouth. Again. Beautiful. Can you give me two more, please? Good job, Johnny. So now I just want to feel for your chest wall movement. So just another deep breath in. And last one. Good job, Johnny. I'm going to come back around to the side of this chair. Alright, so I want you to roll onto your back. Alright, Joni, so same thing on the back. Your breath sounded nice and clear, and your chest wall was moving equally on both sides. So, what I would like to do now is give you the card. The card. So, we had unequal chest movement, and there were some crackles in the upper right lobe. So I just like to do one test called immediate percussion. What I'm going to do is place my fingers right just below your clavicles, so your collarbones. And I'm going to tap on my fingers and listen for a sound. Is that okay? Okay, so I'm going to start on the left side. So you're going to feel me move your skin down a little bit just to pull the top. Now I'm going to do the same thing on the other side. Good. So both sides had resonant sound, which is what we're listening for. So we would, if it was abnormal, we would hear like a dull thud as we're tapping, or it would be very, like higher pitch or bigger. But you are normal on both sides, so that means there's nothing in your lungs clouding the sound. But based on your card, there was sound. So what I'd like to do is attempt what we call a topic. So what I'm going to do is have my hand like this, and I'm just going to be tapping on your chest like that to help break up some of the mucus in your lungs. Is that okay? So I'd just like you to breathe normal and stay right here. We're going to do this for 30 seconds. Okay, now give me a big cough. Okay, how do you feel? Better. Good, I'm glad to hear that. So, the next step is to get you up and out of bed. Feeling okay for that? Yeah. Alright, so I'm just going to get the chair set up. Do you mind if I take your blanket? That's good. Alright, you have your gown covering you all the way down. So, I'm just going to take this and drape it over the chair. Alright, let's get your shoes on. Alright, can I have you help me put your foot right there? Yep, straighten your leg out. Good. And now push your heel down. There. Oops, sorry, I caught the foot in there. Here we go. Joni, what do you like to do for fun?
I like to run and dance.
Oh, what type of dance?
When I was little, I used to take hip hop and jazz dance classes.
Oh, awesome. What was your favorite type to dance?
Hip hop for sure.
Yeah. All right, push that heel down. Push, push, push. Good. Sorry about that. Alrighty, let's try this one. Do those feel too tight, too loose?
Nope, they feel good.
Awesome.
Sorry.
Thank you. That's okay. That was my fault. So, I'm gonna help you sit up. I want you to do as much as you can. I'm just gonna get a couple things set up first, okay?
Okay.
So I'm gonna move my IV pole around over, making sure I have enough slack. Get it over all the cords. Oh. Your bed is having technical difficulties today. I think there was a ghost hitting all the buttons. It's still cut on the cord, I'm sorry. There's one wire back here that's just a troublemaker. Alright, I'm gonna move the chair so it's nice and close when we need it. And Joni, what I would also like to do is take your blood pressure and your heart rate as we're going through. Okay? So I'm gonna put the blood pressure cuff back on your arm. Thank you very much. Okay, Joni, so next step is to sit up. So first, bend this knee. Reach across towards the edge of the bed. I'm gonna have my hand on your shoulder and your hip. On the count of 3, roll towards me. 1, 2, 3. Good job. Okay. Next step is going to be to sit up. So first I want you to kick your legs straight off the bed. Good. This one as well. And move the chair a little bit. Alright. So your arm is on the edge of the bed and so is your elbow. I want you to push through this hand and this elbow. I'm going to have my hand under your shoulders and at your hips. Okay? On the count of 3, we're going to sit up. Ready? 1, 2, 3. Good job, Joni. How do you feel?
Good, a little lightheaded.
Okay. I want you to move your ankles up and down. I'm just going to take a quick blood pressure, okay? Keep those eyes open. Look up at me. Good job with those ankle bumps. Okay, I got 102/58, so a little bit of a drop. Do you still feel lightheaded?
I'm feeling okay right now.
Okay, I'm also going to take your heart rate while we're here, okay? So I got 62 beats per minute. It was still strong and regular, which is good. All right. So what I'd like to do next is I had a gait bump. So I'm gonna have you sit up nice and tall for me. Stay right here. I'm gonna reach a little bit. Have a hand on you at all times. All Alright, I'm just gonna put this gate belt around you. It's gonna go along your stomach, okay?
Okay.
Still lift your arms for me. Good. I'm gonna wrap it around. So it's gonna feel pretty tight while we're sitting here, but when you stand up, it will loosen. How does that feel?
Good.
Okay. So your Foley bag is still doing okay. Your IV is looking good. Just gonna tuck the tail in. Now I'm gonna leave that on again because when you get up and standing, I wanna take your blood pressure again, okay? But while we're sitting here, what I would like to do is test your balance. So I want you to cross your arms across your chest. Okay, I want you to hold strong right here. Don't let me move you. Good. Okay, you can relax. So you're a little bit weak, so I wrote you at a moderate for sitting balance because I can push you a little bit. The next thing I'd like you to do is I want you to take your right arm from under or over your IV so you don't pull it out. Then I want you to reach past my hand. Reach, reach, reach. Good, and come back. Awesome. And now same thing with the other side, okay? Reach past my hand. Good job. That looks really good. So I give you strong for your movement balance today. All right, the next step is to stand up. So what I'd like you to do is put your hands on either side of your hips. I want you to scoot forward. Good. Okay, so this is a little tall, but your Foley is in a good spot. And so is this. We have the chair in a good spot for when you stand up. So it's a little bit of a drop, but what you're gonna do is you're gonna lean forward and stand on up, okay? Okay. All right. On the count of 3. 1, 2, 3. Good. Just loosened a little bit. That's okay. How do you feel standing up? I feel good. Good. All right. I'm just gonna take another blood pressure. You can put your hand on my shoulder. Just rest it right there for me. Still doing okay?
Yeah, I'm doing good.
Alrighty, Jenny, I got 110/64. Let me take this off. That way it's not getting in the way. Alright, I'm gonna move this IV bag a little bit closer to us. This Foley looks like it's still in a good spot, and I have a chair right here. So what I'd like you to do is turn towards me. Good. I'm gonna come under this so it's not in the way. Alright, now there's a chair right behind you. Do you feel it?
I do.
Okay. On both your legs?
Yes.
Alright, what I want you to do is lean forward so your nose goes over my shoulder and slowly sit back. Good. Okay. How do you feel there?
I feel good.
Okay.
Feels good to be out of bed.
I'm sure it does. Alright, Joni, so I'd like you to stay up for a little bit just to get you out of that bed, give you a change in position. And this will also be really good for your heart muscles because it'll work harder to pump the blood throughout your body.
Okay.
Is there anything I can get you before I head out?
No. I feel good here.
Okay, Joni, I'm just gonna get you set up. And so, you did have a little bit of weakness in your arms and legs, so I'd like to keep seeing you to work on that and help you get stronger and get back to what you were doing so you can go back to school. Do you have any questions?
Not right now.
Okay, well, thank you so much, Joni. It was great meeting you. I'll see you again.
Bye.
Bye.